My name is Deborah Lohmeyer, and I want to welcome you to this research article critique. This particular critique is going to be about an article that is written about active cutaneous warming systems to prevent intraoperative hypothermia, a systematic review. In this particular quantitative research article, we're going to look at how active cutaneous warming systems compare to one another. And then we're going to also look at, go through the 4 phases of critiquing an article. So we're going to talk about the comprehension of this article. We're going to do comparisons and analyze it and then give an evaluation. So to begin with, in comprehension, the abstract begins by telling us that this is a systematic review, and it also tells us how they went about compiling all of the articles that they used to put together this particular research article. In that, they used 3 different databases in pulling together 347 different articles and whittled that down to 23 articles for this particular critique or study. They also mentioned what their methodology would be. They wanted to look particularly at randomized clinical trials, and so that was the methodology they wanted to use to include those particular articles within this study. And then they made a recommendation about evidence-based practice. In this case, they did recommend, based on the information in the articles used, that active cutaneous warming systems do make a difference in maintaining normothermia in the intraoperative setting. They also make a recommendation that nurses be involved in the purchasing of those particular warming systems for the patients, because nurses are responsible for not only interventions but also in the purchase of the items that they use in interventions. So they strongly recommended that in the abstract. The article goes on and begins to talk about why we want to use active cutaneous warming systems or maintaining normothermia within the operating room. And they list some of the problems that patients would demonstrate or exhibit in the intraoperative and postoperative periods if they are hypothermic. So their goal was to find out what was the best way to warm these patients intraoperatively. So the purpose of this study, when we're talking about the comprehension of this particular article, and the purpose is, does the evidence demonstrate that the use of these active cutaneous warming systems will make a difference in preventing hypothermia? The literature review that they utilized to pull together all of the literature that they used within this article. They used Medline and the Cochrane library system. They used CINAHL and the Embase. From there, they pulled 347 articles, and using their selection criteria, got that down to 23 articles for this particular research article. The framework that they wanted to use when they were pulling together these articles, they limited it to English, Portuguese, and Spanish written articles. Any other languages were excluded for this particular study. They also wanted to be relevant and current in their selection criteria for articles. So they chose January 2000 to August 2010 for any articles that were included in this. The patient population were patients from the ages of 18 years and older. Also, the patients had to be undergoing elective surgery. If it were emergent or any other type of surgery, those patients were excluded from this study as well. And then the trials that were used in the research articles that they were including in this study, had to be randomized clinical trials. So again, exclusion criteria that they wanted to use within this framework were passive warming systems. In this case, the articles, or this study, again, was focused only on the active cutaneous warming systems. So passive warming systems were left out. If there were medications utilized by anesthesia to control effects of anesthesia as far as hypothermia, those studies were also excluded. If they did any pre-warming in the preoperative area and immediately pre-surgical. And then any patient who underwent induced hypothermia within the operating room setting for their particular surgical experience, those patients were also excluded. The methodology that they used were two of the authors went through these particular databases. They pulled together through the 347 articles and then independently applied their critique information, inclusion, exclusion criteria, and then brought that down to 23 randomized clinical trials that they wanted to include within this particular study. The study variables, again, were the quality of these randomized studies. So the authors wanted to look at how well those articles were written. They applied objectives for that of evidence of the effectiveness of the different warming systems. It was interesting in the abstract pulled out particularly water circulating garments and mattresses as the active cutaneous warming systems. When you got into the article itself, when they were looking at what their objectives were, they actually began to pull those articles out and did comparisons of forced air warming systems to all the other types of active cutaneous warming systems. So it was interesting when you read the abstract and got to the other, what the differences were. So that was a bit unusual or didn't really seem coherent. The question or hypothesis that they posed for this study: what is the evidence available within literature concerning the effectiveness of different active cutaneous warming systems to prevent hypothermia within the intraoperative setting? So we've sort of talked about the methodology that they used. This does list out, again, systematic review. They had some protocol developments with their inclusion and exclusion criteria. They had a clinical question that we just reviewed. Their data collection was pulled from those 23 articles. Then they did evaluation of the quality of those particular studies. The quality was based on JADAD scores, and we'll talk about that. And then synthesis of the evidence. And they did that in a really nice graph. So the results of pulling all of this together were 23 studies that they evaluated and compared forced air to other types of active cutaneous warming systems. And then they did do a discussion based on their findings of the two groups, the inclusion groups, the control group, and the study group. They also indicated that based on their findings, additional study needs to be done. So, the number of participants, it's interesting when you look at the number of participants that bringing 23 studies together. There were 1,309 participants then by pulling 23 articles together. And they ranged from general surgery, urology, gynecology, cardiac, total joint replacement, Those surgeries, most of them lasted above 2 hours. And so that's what they were looking at. Can they maintain a nice patient normothermia during those 2 hours? Types of anesthesia that they used were general, spinal, and epidural. And then the JADAD scores. JADAD has a scoring system of questions that you receive 1 point if you answer yes to the question. You can delineate or take away up to 2 to 3 points for patient populations that dropped out, changes, and that sort of thing. Most of the scoring for these articles ended up being a 3. When we get into the analysis phase, we're going to talk about the systems that they used, and so the first grouping was radiant warming systems versus forced air warming systems. And forced air warming systems, this was an interesting study. They had 4 articles or 4 studies that they included in this. 2 of them said that the forced air warming systems were a much better device to use to keep normothermia, whereas 2 of the other articles said there was really no significant difference statistically. But the total JADAD score for all of those, when they scored them out, ended up being 3. Circulating warming garments, the circulating warming mattress, energy transfer systems, pads, and the warm water pulsation negative pressure systems, they found over longer procedures were actually the most effective in maintaining normothermia. Forced air warming devices, overall though, were equal to or better than most for this selection. The type of device, as in manufacturer, didn't make a difference at all. They all warmed the patient and kept normothermia. And also, upper body warming versus lower body warming, both were effective in warming the patient. There was one study that had a total of 29 patients, in the cohort. And that was with energy transfer pads. And they found that those were the most effective. However, because the patient population was so limited and so small in size, they said further study was going to be necessary for that. In our phase 4, or evaluation phase of the study, the study question was very general at the beginning, as in active warming systems. But when you got into the meat of the entire study, what you found was it was actually a comparison of forced air warming systems compared to all other kinds of warming systems. And those were like radiant warmers, the circulating water systems, electric heating pads, carbon fiber, energy transfer. And so those are all the kinds of warming systems that they included. The evidence, though, did indicate that these active cutaneous warming systems to prevent intraoperative hyperthermia were very effective and should be utilized clinically. So, what we learned from this study is that a systematic review of the articles, very strong evidence, and a very good study to use. The weaknesses, 3 languages. The JADAD scores were low, technically being only 3 on a scale of 1 to 5. And that the newer technology has to have more study. There really weren't any ethical or legal issues with patients that I noticed within this particular study. The theory was that active cutaneous warming prevents hypothermia. Actually, in practice, what you're going to find is there are various interventions and technologies that are used in the operating room. And that research included the excluded combinations of interventions and technologies. So we need to look at active cutaneous warming systems as being part of the patient warming as part of the nursing and as part of the patient. This is the references, and I want to thank you for being part of our research article critique, and I hope you have a great day.